All right, good morning, everybody. Thanks for being here. We appreciate your coming out. I want to say, before we talk about healthcare reform, I want to talk about what's a little more immediate, and some of you inevitably will ask me about it, and that's the snowstorm tomorrow. We're having snow, so 'tis the season, and we will, as predicted, we are going to have a significant snowfall. We're seeing estimates of up to 14 inches of snow for New Bedford, and starting very early in the morning, so we're gearing up. We had a big snow prep meeting this morning in which we talked through our game plan, as we always do. Every snowstorm is different. How much snow, when it starts, how close the rain line is, and many other variables have to be evaluated in order for us to know how to deploy our resources, with the goal being, after all, making sure people are safe and making sure that the city gets back up and running as quickly as possible. So there will be more information that we will put out by press release and Facebook and other means, but I did want to give people a heads up about a couple of things. So we will have a parking ban in effective at midnight tonight. That means that in general, the rule is that everybody should park on the side of the street opposite the fire hydrant. There are certain main streets in the city where the parking ban is in effect on both sides. The list of those streets are on the city's website, so you should take a look at them, but it's most of the main drags these days, and we've got to clear those routes so that obviously emergency vehicles can get down and do their job. So I would just ask everybody to just make sure we honor the parking ban. We will have announcements about things like schools later on. City offices will be closed. Things like libraries, senior centers, the zoo will be closed as well. So again, we'll have more information to put out, but I wanted to get that out there as soon as possible, especially the point about the parking ban. We want to give, if you violate the parking ban, your car is subject to towing. We want to give people as much of a heads up as possible about that. So we're giving that heads up now, and we will repeat it and repeat it and repeat it so that everybody knows. And we appreciate everybody's anticipated cooperation, and we'll work really hard at getting the city back up and running. I do want to note one other thing. It is, as I said, every storm is different. What's different about this one is a couple things that are relevant. One is, as we know, it's been very cold, so that means that all the water in the catch basins around the city is probably frozen solid, so it means that when water flows into those catch basins, it might not go anywhere, and so we might end up having a little bit of flooding. That wouldn't be so much of a problem if it weren't for the fact that it is going to get really cold for the next few days. So the long and short of it is that we're going to have icy conditions no matter what over the next 3 or 4 days. So we have to be careful. Our crews are going to be out sanding and salting and putting magnesium chloride all over the place to facilitate melting, but people need to be patient. This weekend, let's try to stay off the roads as much as possible, and then I think we have a warm-up, knock on wood, on Monday. So that's snow. Let's talk about healthcare. And let's talk frankly about our ability to pay for things like snow removal and just about everything else that we do in our city. And I addressed this the other night in my inaugural address, but it bears emphasizing a few things. That everything that we're doing in the city depends on our ability to pay for basic services, the kinds of things that people deserve and expect from their government. And that runs the gamut from public safety to schools to everything I just named, snow removal, libraries, and so forth, senior centers, et cetera, et cetera, et cetera. But the reality is, over the last few years, that money has been very tight, and it is getting tighter all the time for us to deliver on those services and also ease the burden on taxpayers. Over the last few years, we have made significant cuts to city government, and city government is considerably smaller than it was 10 years ago and much more efficient than it was 10 years ago. Yet the pressure on taxpayers has only grown. And this is during a time of relative growth, mind you. As we know, New Bedford has had considerable growth in a number of industries. Tax receipts are up, but they're not growing nearly as fast to keep up with our major expenses. And I'll talk about what those are in a second. And so we have to be concerned about this. We have to be concerned that when the national economy takes a dip, as it inevitably will, what goes up must come down at some point. And as we know from experience, when that happens, we will see cuts in things like state aid and drops in local receipts. When all these things happen, we're going to need to, we don't want to be in a really precarious position. That's happened to a lot of cities. And if you go, for instance, to the neighboring state of Connecticut right now and look at cities that are more or less the same size as New Bedford, Hartford, Waterbury, New Haven, Bridgeport, they're all on the cusp of bankruptcy. Hartford, the state capital, is. That's the most affluent state in the nation, and all their cities are in that predicament. I'm not going to let that happen to New Bedford when the economy turns. It will not happen here, nor will I allow the taxpayers of this city, the residents and businesses alike, continue to bear expenses that are out of control. And the big budget drivers here in the city are healthcare, pensions, and charter schools, and that's depicted right in that graph right there. That's what's driving the budget. If you want to know why things are going up, it's not because people's salaries are fat. It's not because there's waste and fraud and abuse and all that stuff. Sorry, that's not the case. Not here in New Bedford. That's the problem. It's healthcare, it's pensions, and it's the charter school mandates. All three of those things, and that's what's imposing on taxpayers. So when you hear a local business owner talk about his taxes and lament the fact that here in New Bedford, small businesses pay a lot of taxes, those aren't empty complaints. Those are real. The last time I checked, which was about 2 years ago, when we saw the state rankings of our commercial tax rates, and I am even reluctant to highlight this publicly, New Bedford has the 9th highest commercial tax rate in the Commonwealth of Massachusetts. The 9th highest. That's not good. That doesn't make us competitive. When it comes to residential taxes, they've gone up and up over the last few years. And I've heard it all over the place from folks who live in large homes and small homes and everything in between. And I've heard it from the likes of countless seniors who are living on fixed incomes, whose tax bills, the escalation of whose tax bills really puts a squeeze on their quality of life. And in some cases puts them on the brink of having to sell their own homes that they'd love to stay in and that they plan to stay in. That's not a good situation. It isn't. This isn't, what you're hearing from businesses and residents in the city are not empty complaints. It's a very real imposition. The problem is that if these are the budget drivers, and they are, there isn't a whole lot we can do about them, because charter schools, by charter school mandates, as the name implies, and as Lou St. John would tell you, is a mandate from the state. You will allow the school to happen, and you're going to pay for it out of your own dime. Employee pensions, that is fixed, fixed and growing. That is a mandate by the state. We've got to pay it, and that is growing. But the biggest driver is employee health care, and this is what we're here to talk about today. There is one lever that, frankly, we can pull that is, compared to a lot of the other budget options to the city, relatively painless. And I say other options, if we want to have a fully functioning police department and fire department and schools and everything else, this is really the place that we have to look. Under state law, the city has the ability to adopt what's called a provision in a municipal healthcare reform bill that we often refer to as Section 21 through 23, Section 21. And basically it allows cities to go to an arbitrator when it negotiates its healthcare plans with its municipal employee unions. This is something that cities around the state can do, and many have adopted. In fact, the majority of municipalities have adopted this in Massachusetts, and there's a good reason for it. And the reason is this: if we can't come to an agreement with our public employee unions right now on the terms of their health care benefits, we, the city, we, the taxpayers of the city, have no recourse. We have to accept no for an answer. And therein lies the problem. New Bedford's healthcare costs are growing very, very rapidly, and compared to other places, our healthcare benefits are very, very generous. And that's fine if you can afford it, but the reality is the city can't afford it anymore. We just can't. And so if you look around the state, again, if you look around the immediate area, if you look around Greater New Bedford, just about everybody else has done it. And that's what this depicts right here. Here are the communities in southern Bristol County, in Greater New Bedford and slightly beyond, that have adopted this provision. And you'll note that only New Bedford and the town of Westport have yet to adopt this provision. I cannot speak for Westport, but I think it's safe to assume that all these other communities recognize that not having this provision at their disposal would render unmanageable their health care costs, their employee health care costs. And all of them have adopted it. All of them have saved considerable taxpayer funds, and all of them will tell you, no, it didn't just totally disrupt employee health care plans. Their employees are still covered. And so one would look at that and ask, well, why can't New Bedford do that? Why can't we take what is a step, a unnovel, modest step to control the spending of taxpayer dollars on something that is becoming unaffordable? We have to do this. We would be irresponsible as government officials if we didn't propose this. You, the public, entrust us with your hard-earned money. That is a weighty responsibility. And we as public officials have to take that seriously, and we do. And the officials who are standing up here with me do, and other city councilors as well. We want to work through this. We need to take this step so that we can actually have a manageable set of health care plans for our city that provide our employees with what they need, but also ensure that taxpayer dollars are being spent responsibly and sustainably. And we don't have that right now, and we won't have it without the adoption of this provision. So that is why we are here today. And so we are going to, I've proposed the adoption of this provision before, back in 2000, way back in 2017. We're going to do it again. We are going to be resubmitting this to the City Council. I've had a number of conversations with city councilors, including City Council President Morad, as well as every other city councilor on this. This is a discussion the city has to have. This is real money. This is real people's money that we have to manage better. And if we're not doing it, shame on us, because just about everybody else has found a way to do it. So with all that, I want to say a couple of other things. So one might look at this and say, well, can't you cut somewhere else? And we've passed around, I think Ari's passed around a copy of the budget and the budget pie, what it looks like. And you've heard me say this before, so much of what we spend our money on, the vast majority are things that we don't have a lot of control over. So you might say, well, why don't you cut the school department a little bit? Well, the short answer is we can't here in New Bedford, because we have, for years now, we have budgeted our school budget at the statutory bare minimum. It can't go down. It's irreducible. Well, what about things like regional mandates, right? So things like we pay for vocational school and Bristol, the operation of Bristol County government. You can't do that. What about all the rest of the city departments outside the school department? Well, right now, really the only thing you can do is just reduce the number of people who work here. And there are some 200 people fewer working for the non-school departments in the city than there were in 2008, 10 years ago. The city government has shrunk considerably. And so we're at a point now where it's either you provide the services we have, which are not nearly enough, which we need to bolster, or you raise taxes. I mean, that's it. Or you do this. We're at a point now where efficiencies won't work anymore. It'll just be dabbling on the margin. So if there are anybody who suggests otherwise, ask them. You have to ask them. If you think taxes are too high in the city, tell me, where would you cut? Not just like, oh, we'll give the mayor a pay cut, something like that. Ask them, seriously, where would you cut to really make a difference to taxpayers? Alternatively, ask them, all these, if you agree that taxes are too high, ask them to look at that map and say, tell me why New Bedford can't do that. That's, everybody in this city should ask that question, and that's what we have to be prepared to do. And we would be shirking, again, we would be shirking our duty as public officials if we didn't initiate this discussion, because it's really important for the long-term future of our city. So I appreciate the work that the City Council has done on this. I appreciate the leadership of Linda Morad and the discussions that we've had, she and I have had. I appreciate the work that other city councilors have done on this. These aren't easy decisions to make, but there are times when public officials have to step up and make the right decision on behalf of the residents, on behalf of their constituents, and this is one of those. So, with all that, I want to call Ari up to talk a little bit about some of the details of the law, and then I'm going to ask the city councilors to come on up and say a couple of words. So, Ari, why don't you see if you can add in a couple of gaps.
Sure. So the pie chart the mayor alluded to, I have here. I'll hand out to everybody in a little bit. I want to talk a little bit about parameters here. There's some disinformation out there about what is involved here. The city's not looking to change the contribution rates at all. In fact, health plan redesign doesn't allow you to do that. The municipal health reform law makes it very clear that the current split of 75% to the city, 25% for the employee, remains in place in the redesign that has to be done, would have to be negotiated separately through collective bargaining. So there has been some confusion out there as to whether the city is looking at that piece. We're not. What we are looking at is a process where we would be able to engage with the unions to be able to talk about the design of our health plan and to make it something that's more affordable going forward, both for the employees as well as for the city. The plan right now is on a trajectory that is frankly not sustainable. I'll give you an example. The FY18 budget increased the levy by $5.9 million. The healthcare line went up by $3.5 million. So it's more than half, so equivalent to more than half of that number. Now, it's not a direct correlation because the state revenue increases and things like that, but any savings in healthcare would have reduced the levy increase. That's very clear. The health coverage for city employees is excellent. It involves almost no copays for retirees, and the copays for employees are quite low. What we've tried to talk to the unions about is looking at those co-pays and some of the deductibles to try to make them a little more competitive to the market and to help bend the curve a little bit. We proposed those changes to coverage last year. They were mainly limited to co-pay adjustments and deductibles, things along those lines. The unions declined to engage in that and said they weren't interested. Instead, they asked to increase the premiums, which frankly means when you increase the premiums instead, that goes straight into that number right there, that $3.5 million. So really what was being said was we'll take our 25% for the employees and the rest goes to the taxpayers.
Explain to them what the contribution split is so everybody knows.
Sure.
Understand.
Sure. So everybody knows when they have health care, they pay premiums for their health plan. The amount that you pay and that your employer pays, assuming it's employer-provided health care, varies place to place. In New Bedford, the city pays 75% of that premium cost, and the employees pay 25% of the premium cost. So the question that we're talking about, that $3.5 billion, is the city's share of that cost. Now, New Bedford is self-insured, which means that we run our own health plan. Some have asked, why can't we just change health carriers? That really would change the difference. The cost of our plan is dictated by the costs incurred for medical costs. And the health plan, the health carrier, Blue Cross, Harvard Pilgrim, whatever, currently is Blue Cross, is the administrator. Now, we do have one insured product, that's called MedX, and that's for our retirees who are on Medicare and fills the gaps there. Provides a very generous benefit. The change to Blue Cross, which we did several years ago, from Harvard Pilgrim, reduced the MedX cost significantly, and we saw some savings in that first year as a result of that. Section 2123 is really the norm, not the exception. As of 2013, the Patrick administration did a report. There hasn't been one done subsequently, but as of that report, 165 municipalities and 39 regional school districts had had adopted Section 2123 to address healthcare costs. We were looking to save somewhere in the neighborhood of about $1 million off of our increase in 2018 through our discussion with the unions. Unfortunately, that didn't progress, so as a result, we had a $3.5 million increase. Again, let me emphasize, this does not allow us to change the contribution percentages. We're looking strictly at the benefit, at the co-payment levels. Mainly we're proposing this, not so much this does not allow us to impose a number on the employees when it comes to benefit levels. What it does require is for both parties to engage in a negotiation and insist on the process. That's really what we need now, is a process so that the unions and the city can come together and actually talk about the plan and move forward on figuring out what works best for the taxpayers and for the employees. So that's pretty much an overview of everything. I'll be happy to hand out these pie charts in a moment when the press conference is complete.
All right, thank you, Roy. All right, and I'd like to call up City Council President Linda Morad, who has been a champion of ensuring that taxpayer dollars are wisely spent and responsibly spent in our city. And I just want to thank Linda for her leadership on this issue and ask her to come on up and say a few words. Linda.
Well, thank you, Mayor. And as the Mayor said, over the course of my term, I've been on the City Council trying to show fiscal responsibility and leadership. And frankly, when this item came forward at the end of 2017, I'm not positive that there was enough dialogue. I'm not sure that there was enough understanding, both on the council's part and on other people's part, as it relates to what was being proposed. Since that time, there's been a lot of conversation, as you will, from the administration to both the existing councilors and the new incoming councilors regarding this item. And frankly, I believe that the council is still very split as it relates to how this discussion should move forward. So I use my time here at the podium to say to those members of the union that have the ability to sit at the table and to negotiate that it's time between now and January 11th for you to have some serious dialogue with the administration in the city about how we together can work. Number one, to protect the city employee, who I've also been a champion of in my entire career, and the taxpayer. And let's sit down and talk and negotiate before we're mandated to sit down and negotiate. And I applaud the mayor for his attempt to control the costs of the city as it relates to this line item. But I am concerned that this will in fact increase money out of the pocket of the city employees, of which I am one, who will have to bear the burden of this change. So it's time to sit down and talk and see if there is some type of alternative that you can reach without passing the mandate. But I do believe that if there's no substantive discussion and some movement, that you will probably see the council take the responsible action, which is to pass the item, to have some serious dialogue, and to hopefully reduce the increase in the growth of the healthcare of the city of New Bedford. So I thank you for the opportunity. I am one member of the New Bedford City Council. There are 11 of us, and there's 22 opinions. And I know that many of them feel strongly in another way, and some of them also feel strongly that they will not pass this item. So there's more dialogue to happen, and there's more discussion to be. And I appreciate the fact that the administration has been forthcoming and inclusive in this discussion at this point in time. Thank you, Mr. Mayor.
All right, thank you, Council President Morad. Would any of the other councilors like to speak today? Anybody? Anyone?
I'll just say a word or two.
Scott Lima, Ward 5 Council.
So yesterday I got my first phone call from a constituent, and she's an 85-year-old woman, a lifelong city resident, and this is exactly what she was talking about. Well, she was talking about her property taxes. She just can't afford them anymore. She's talking about maybe moving to another town, selling her house. I want people to stay in their homes. I believe in communities. I believe in neighborhoods. But, this is really affecting people. 85 years old, you don't know if you can stay in your home. people are getting squeezed. I mean, when I was out there campaigning, people are telling me that they're getting squeezed. I myself will be going on to the city's health insurance plan. I've worked in human resources in the past. I've known for 30 years that healthcare costs and education costs were going to rise exponentially compared to other sectors in industry here in the United States. So this is nothing new to me. So again, 85-year-old woman calling, really having a tough time, and so I'm hoping to help folks out like that. And I don't want to see the city get into a situation where we're talking about bankruptcy or anything even close to that. That's just not a good situation at all. Bond ratings get affected. I mean, that's going to cost money right there. So, we really need to take a good look at this, more dialogue, and I'm happy to sit down and talk to anyone about this. So, thank you.
Thank you, Councilor Lima, for your leadership on that, and that hits it exactly on the head. There were too many people who fit that profile, too many people in the city, seniors who are being squeezed by taxes, and that's why it's healthcare costs, and we've got to deal with it. I want to call up a champion of seniors in this city, City Council at Large, Deb Coelho. Deb.
Thank you, Mayor. So good morning, everyone. I too got a phone call yesterday from an elderly man that was very, very upset and angry about his taxes going up as well. So those calls are starting to come in. With that being said, I just want to say when this was first introduced to the council, we didn't have enough information. So we did not even discuss it. We just voted it down because we just didn't know what we were voting on, and that was several months back. Now we've had an information gathering session. We've sat down with Ari Sky, the CFO, and we went through all this. And it really is the way to go. And I'm not really looking at this as a bargaining chip for the unions to come forward and try to initiate that, okay, they're going to bargain correctly, and that's fine, and that may be fine for this year, but I'm not looking for this as a bargaining chip. I just really think that the way it's proven to work in other communities, I'm looking for it to come through again as the initiative of the Section 2123. I'm ready to vote for it. I think things are changing really rapidly in our country and obviously in our city, and I think this is progressive. We have to move forward, and I want to remind folks that not everybody has decent health insurance. We are very fortunate here in the city of New Bedford to have the insurance that we have. We're going to continue having the good insurance, but obviously it's going to be at a bit more of a cost to those that have the jobs and can afford that cost. That's what we're looking for. And the other thing that I brought up, and I'm going to bring it up again, there's health incentives that we can bring up for our workers, and we really need to talk more about that. People have to start assuming responsibility for their health in ways that preventive measures to save their health and also on the taxpayer, because the taxpayer just can't afford it anymore. This is all about affordability. New Bedford taxpayers cannot afford what we have right now, and we have to think beyond, and we have to think progressively, and sometimes, and this is one of those times, it's going to hurt. But that hurt is to benefit each and every one of us, especially the New Bedford families that need to worry about their own homes. So thank you for the opportunity, and I'm going to take this opportunity to encourage the newcomers and new councilors and the council themselves that when this comes before, we need to review this again before the council, and this time we really need to seriously vote, and that vote should be yes for the taxpayer. Thank you.
Thank you, Councilor Coelho, for your eloquent summary of the need here. There is just no escaping it. Taxpayers have been imposed on in the city, and people might ask, well, why aren't you doing something about it? This is doing something about it right now. Last, I want to call up Councilor from Ward 1, Brad Markey, to say a few words. Brad.
Thank you, Mr. Mayor. At first, I wasn't going to say anything, but then when my other councils were mentioning about getting calls from taxpayers, I got my first call last night. It wasn't from somebody who was retired or anything like this. It was from somebody, she works, her husband works, and she was complaining about the tax bill. So, of course, I'm new at this. I'm just getting my feet wet into this. And taxes are an important, especially in Ward 1, we're walking around. I'm a sales rep. I've been a sales rep for over 30 years. And in my business, it's a win-win. That's what you want on both ends. So my thought process was, you can't put too much of a burden on taxpayers, but also you don't want to put too much of a burden on our employees and our retirees. So I would hope by doing this, we could sit down, have a good conversation, and then we win-win on either side. So when we get done, there's probably going to be some give and take, obviously, but I think when we get done, I would like everybody to feel like, yes, it's a good process, and people feel good with it. So again, I'm looking for a win-win. Thank you.
All right, thank you, Brad. All right, let me open it up to questions.
If the council does pass the issue to get an arbitrator, how long would that arbitrator be in control of these cities' health care?
The arbitrator is not in control of anybody's health care. What the arbitrator would do is this, like as with other arbitrations, one side would say we want X, the other side would say we want Y, and the arbitrator would either pick X or Y or something in between.
With the other municipalities that have done this, have you gotten responses as to they like it, they don't like it, what it's kind of done to benefit them?
Well, the officials in the other cities have said unequivocally, we had to do it. We had to do it because healthcare spending was out of control, just as we're experiencing right now. And so, Fall River did it a few years ago and saved $3.7 million annually. And so, we've heard remarks from folks that, to the effect that, well, it's just the, New Bedford suburbs that have adopted it. Now, the reality is that most of the communities in the state have, and the city of Fall River as well. Most recently, Somerset adopted it just last year and projects an annual savings of about $800,000. That's real money. It's real money that, in a town as small as Somerset would go a long way. We want to do the same thing here.
Yeah, can I throw out one thing real quick about arbitration?
Yep.
So, one thing I don't want to make sure this arbitration by the state, by the if the performance of other jurisdictions is a prologue, arbitration is the exception, not the rule. In the past 4 years, there's only been, I believe, one arbitration case. That was the town of Falmouth, right? Which ruled in favor of the town. This process is intended to encourage you not to go to arbitration, but to negotiate it out. But to require that negotiation to happen.
Well, that highlights an important point that everybody should understand. These things ordinarily don't get that far, but the threat of arbitration does. And by the way, arbitration can be a lever that either side pulls. So if the city is not bargaining in good faith, the unions can seek an arbitrated decision. Well, it highlights this fact that it levels the playing field. We talk to the unions. We've been talking to the unions for the better part of the year for this, and we've gotten nowhere with it. When you have a threat of an arbitrator, it means everybody really has to start discussing things for real and not just talking and blowing off meetings and not getting things done. That's the difference. Talking, we talk, and talking doesn't get you anywhere. Real substantive discussion that is forced by the possibility of an arbitrator actually gets people somewhere, and that's why it can't be, well, you guys just go back to the table and work it out. That is well in the rearview mirror at this point. We'll continue to talk, we're open to talking, but you know what, those talks are not going to get us anywhere unless there is a commitment forced by both sides by the threat of arbitration.
How many meetings and how long have they been going on to discuss this?
We can fill in, so at least since last March. Numerous meetings that didn't materialize and so forth. Okay, anybody else?
Can I ask Linda?
Yeah.
Linda, how much confidence do you have that the council can pass this, and what has changed? I know Deborah got into a little bit. What has changed since the last time this came up in front of the council?
Well, I don't know if the council will pass it. Some of my colleagues standing behind me have indicated that they're in favor of it. There are some that are still concerned. I heard the mayor's comments a minute ago about the fact that we're beyond sitting down and talking. I'm hoping we're not. I'm hoping that the union representatives that are here and all of those that will hear this, I'm sure shortly, understand that the council's pretty serious at this point. the council is saying you guys need to begin a very substantial dialogue between now and January 11th. And if you don't do that, don't talk to us. You're talking to the wrong people if you're talking to us. You ought to be sitting down and talking to the administration, and there should be some type of discussion, serious, substantive discussion between now and January 11th, or I do believe that the council will probably pass this and the mandate will be in place.
All right, well, thank you very much, everybody. We appreciate your attentiveness, and I guess we'll be talking about snow tomorrow. Thanks.